Welcome to the first episode of In Conversation. I'm Kirsten Bibbins-Domingo. I'm the Vice Dean for Population Health and Health Equity in the UCSF School of Medicine. Population health seeks to understand how biological, behavioral, environmental, social, and structural factors all work together to affect health. We hope to use this knowledge to design better interventions to improve health, both for individuals, communities, as well as populations. And importantly, one of the goals here is to improve the inequities that we know we see in health across our communities and populations, locally as well as throughout the country. In this series, we hope to introduce you to some of the important work that's being done here by UCSF faculty, staff, and many of the programs. And our first guest in this series is Dr. Hilary Seligman. Dr. Seligman is professor at the University of California, San Francisco, and she has appointments in the departments of medicine and epidemiology and biostatistics. She directs the National Clinical Scholars Program, which is launching this year. This NCSP program aims to offer unparalleled training to clinicians as change agents, driving policy-relevant research and partnerships to improve health and health care. She is a recognized expert in food insecurity and its health implications across the life course. Her policy and advocacy expertise focus on federal nutrition programs, particularly SNAP, food banking and charitable food networks, hunger policy, food affordability and access, and income-related drivers of food choice. She founded EatSF. Please join me in welcoming Dr. Seligman. I will call you Hilary for the rest of this time because you and I are friends and colleagues.
Sounds good.
So I hope this can be a relaxing conversation. So I wanted to start by giving you the opportunity to tell us what EatSF is.
EatSF actually formed in my head as a response to seeing patients in our clinic at San Francisco General Hospital for whom I could prescribe medications. But for many of my patients, what they really needed and wanted access to wasn't just medications, but also healthy fruits and vegetables. And so the intention of EatSF was to give us a mechanism by which we could prescribe fruits and vegetables. And we decided to do that by creating a fruit and vegetable voucher. EatSF is now a large citywide fruit and vegetable voucher program where we provide vouchers through distribution sites across the city to low-income, food insecure residents of our city. And they take those vouchers to grocery stores, corner stores, farmers markets all over the city, and they are redeemable for $10 worth of fruits and vegetables.
So that's interesting. So we sometimes hear that that people might not be that interested in eating fruits and vegetables. That's the reason people are not eating those in large quantities. You say you noticed this amongst your clinic patients. So tell us about whether there really is a demand for eating healthier.
Well, there's two opposite answers to that question, actually. The first answer is everyone in America has a preference, for the most part, for unhealthy foods. And that's because we are physiologically wired to like sugar and fat. And our food system encourages that tremendously. On the other hand, we know from a decade or more of research into the food preferences of low-income households that the food preferences are remarkably similar to the food preferences of everyone else. So why is dietary intake of healthy foods lower? Well, it's lower for many reasons. Low-income households are the target of much more marketing around unhealthy foods. But a primary reason is because healthy foods cost more, and they particularly cost more calorie for calorie. So if you're living on a very small food budget, it's a rational economic choice to choose a very energy-dense food that tends to be an unhealthy food. And what we try to do with these food vouchers is to lower the financial barriers to purchasing healthy foods so that people are able to do that again. And what we see, not surprisingly, based on the research, is that low-income households spend that money on fruits and vegetables because they're considered luxury items.
Great. So I know that that ESF started in San Francisco, but it's expanded out. And it's now known as Vouchers for Veggies in other parts outside of San Francisco. Tell us about that expansion.
We have been really thrilled with the uptake in San Francisco and the degree to which people enrolled in the program really have started to not only rely on it, but think of it as one of the most impactful interventions that they are exposed to in terms of supporting their health. And because of that success, we have had requests for technical assistance and for support to create similar programs in other regions. So we provide the backbone of support for the program that is now up and running in Boulder, Colorado. We also have a small program in Los Angeles that is seeking to expand tremendously over the next couple of years. We think that local voucher programs, which allow local municipalities to create their own systems to support healthy dietary intake, is a really important mechanism for making the entire local food system more healthy. In many areas, San Francisco included, we have these regions that are traditionally known as food deserts where access to healthy food is low. And what we've seen from a lot of research is that the natural response to that, which has been to just plop a full-service grocery store into that neighborhood, has not been very effective. In many, many cases, that grocery store has gone out of business. And what we have realized from those experiences is that the fundamental problem in food deserts is that there isn't enough disposable income in the community to purchase the healthy foods. But if we can be the driver of money into those neighborhoods that is spent on fruits and vegetables, then the markets respond by stocking those fruits and vegetables, and they stock them at higher quality, at greater diversity, at more quantity, because people are coming in and buying them. And that's what you have to do for a perishable product, is make sure that there's adequate money in the community to purchase those foods.
One thing that strikes me as so interesting about this is that you describe this problem that we know is pervasive and exists in so many areas of the country, and has some generic underpinnings, similar underpinnings, but that the solutions themselves oftentimes are very local in how they play themselves out locally. And I know one of the things that you did here in San Francisco was to really partner with both departments of public health and other organizations, but also the vendors themselves. Can you talk a little bit about that?
From the beginning, we understood from working very deeply in the community, and particularly in food access within the community, that there was enormous strength in San Francisco. There were community-based organizations all over the city that really tried to support the health of the people that they interacted with. There were grocers on street corners and even in the large grocery stores that wanted to be great members of their community and support the stocking of healthy foods. They just couldn't afford to do it because they weren't getting purchased. And so our vision going in was, let's not recreate anything that the community already has in great capacity. Let's just add to it that one thing that's missing. And the thing that was missing was just the dollar value of the purchase. And so the system that we created was one in which we at UCSF are responsible for creating the voucher and distributing it into community sites across our low-income neighborhoods. And everything else the community has taken care of because they have the capacity to do that. We use existing grocery stores, we use existing community-based organizations, we use existing clinics, and that network has been incredible partners to enable us to do this really efficiently and to do this in a way that is really centered on what people in the community need rather than what we as physicians need or we as UCSF needs.
Wonderful. You used the term food insecurity at the very beginning, and I want us to have a broader conversation about food insecurity, and maybe you could start by giving us a definition of what that is and how common is it?
Mm-hmm. Food insecurity refers to lack of reliable access to enough food to lead an active, healthy life. In the United States, food insecurity is really measured as an economic construct. It's really about, do you have enough money to purchase adequate food, including the healthy food you need to stay healthy. The USDA regularly measures food insecurity, and prior to the pandemic hitting, because we are seeing things change every day, 11.1% of all US households were food insecure.
So a fairly common occurrence then, not something that is rare. And now we're in the midst of the pandemic, and I've heard some say that pandemic is itself an X-ray that is exposing those things that are underlying and often inequitable in our communities. How do we think about what is happening with food insecurity in the context of both this large infectious threat, the need to shelter in place, the impending economic consequences of people being out of work, likely as a consequence of all of this? Can you knit those things together for me to think about how we would think about food insecurity?
We are seeing across the United States, what I am thinking of is two simultaneous crises. One is an economic crisis, and the other is a public health crisis. And when you think about food, food is deeply a part of both of these crises. It's deeply a part of the public health crisis because people need access to food to stay healthy. And many of the risk factors for complications from coronavirus are risk factors related to long-standing lack of access to healthy food, risk factors like obesity and diabetes and heart disease. And so the people who are food insecure, have been food insecure their entire lives, are now the people who are at greatest risk of complications for coronavirus. They're also at greatest risk for developing any symptoms at all. Why? Because these are our frontline workers who are working in grocery stores and other essential businesses. And they are also people who are out in the community face to face and are not able to shelter in place. So lots of impact in communities that tend to be the most food insecure. At the same time, this economic crisis is having a tremendous impact on the food supply. And in particular, it's having a tremendous impact on the food supply for low-income households, because all of the places where low-income households often get food from are being disrupted. So for example, the children are often getting school meals. Schools are closed, no school meals. The workers are often having to take their children to the grocery store with them if they are single parents, for example. What do you do if you don't want to take your kids to the grocery store with you? Again, single parents are at much higher risk of being food insecure. Increases in prices make it much more challenging for food insecure households to afford food. And of course, the lost wages are having a tremendous impact. So it's an enormous double whammy, and there has had to be tremendous innovation within the support system that supports food insecure households in order to continue to provide food and massively increase quantities of food during this pandemic.
So everything we know, we're recording this on April 24th, and everything that the experts are telling us is that we're not anywhere close to the end of this, that we are just at the beginning of what you're describing as our public health and our economic crises. Talk a little bit about the ways in which those support systems, those organizations, community organizations are working together in our environment to address this deep need that is clearly growing.
First of all, I want to emphasize how important it has been that the food system is a recognized part of emergency response, and how disaster planning has always included in this city the critical focus on how people are going to access food, particularly low-income households. What we have had to do is work on the fly to try to plug as many holes as we are able to by using different distribution mechanisms, different systems. Let me give you just a couple of examples in San Francisco. When the schools closed, we needed a mechanism to distribute the free and reduced price lunches to school children outside of their being at school. And so how do you do that? Well, things happened very quickly across the country. Meals were put on school buses, and the school buses drove their typical routes and stopped at each of their stops and delivered the food that way. Distribution sites were set up in parking lots so that parents could bring their kids and pick up a lunch to take home with them. There was tremendous innovation, and there are also tremendous challenges to taking an entire food system and just changing it on a dime, so that instead of serving a hot meal to kids in a cafeteria, now you're serving packaged meals for kids to take home. So enormous work and enormous lessons, I think, that we can learn from this experience for feeding kids during other times when they're not in school. For example, during the summertime, which we know is a time when food insecurity rates go up in the city because many kids have lost access to school breakfast and school lunch. Within the food bank and food pantry system, there was also the need to change overnight from a system where most food pantries looked like little grocery stores for people to come in and shop, often in small spaces, to switching overnight to these very large pop-up pantries where people could drive in and, without getting out of their car to expose others to contagion risk, have food delivered into their trunk, or to stay 6 feet away from the people in front of them and have food delivered to them on the sidewalk. There was also a massive development of a home-delivered grocery program within the food banking system to reach those older adults and disabled adults who really should not be leaving their homes at all. So again, massive innovation within the system in a short period of time to try to meet the need. And we know that these have been incredibly effective, but that the demand is far outstripping the capacity, even in this city, to take care of all the food insecurity needs that are developing.
It's hard for anyone to speculate of what we're going to look, how this will continue to look next month or the next 6 months. If you were to speculate, what do you think are the opportunities, and what do you worry about as the next 6 months go forward? And then perhaps how could people who want to help address this issue get involved in something to do that?
Well, one of the things that we're really excited about is that we see EAT-SF as an important component of this emergency food system. And one of my worries is that people will start to forget about the needs of food insecure households when the acute focus on the pandemic is over. The shelter in place will be lifted. For many people, life may go back to normal relatively quickly, and we are still going to have many households in San Francisco that are behind on their rent, that are behind on their credit card payments, and are not able to quickly catch up. One of the things that we're excited about in this space is that EAT-SF already had the infrastructure in place to quickly try to meet some of these needs that were developing so rapidly. And we did that in 2 ways, or in 3 ways. First, anybody who was receiving EAT-SF vouchers and for whom their enrollment on the program was set to end in April or May, we have extended that so that people can get through the pandemic without worrying about their EAT-SF vouchers running out. The second thing that we have done is recognizing disruptions in the food supply system and difficulties in accessing food. We have developed a new voucher that is redeemable for any foods, not just fruits and vegetables. And we are undergoing massive efforts to put those into the hands of people who are food insecure, so that during this acute time period, people can purchase any foods that they need, not just fruits and vegetables. And the third thing that we have done is really tried to open our enrollment to people who have been directly impacted by the pandemic, meaning that they have been ill themselves or have family members who are ill, for whom we know that returning to work is going to be an additional struggle. For many of these people in San Francisco, we know many of them have other barriers to work, and in many cases, because of documentation status and language capacity and other issues, they aren't necessarily eligible for some federal benefits like SNAP, and in those cases, EAT-SF is filling a really enormous need.
And how can others help in these efforts, either with ESF or other agencies that are supporting food insecurity in the city?
The San Francisco Marin Food Bank needs volunteers, and at their website, you can indicate your capacity to volunteer with them. They particularly need volunteers who speak Chinese and Spanish, so please go to their website if you have that capacity. ESF is distributing as many vouchers as we have funding for as quickly as we can. So if you are interested in making a financial donation, that money goes directly into the value of the voucher, and we can get that money into the hands of a low-income household very, very quickly. I think the other way that people can be enormously helpful is by communication with their state, local, and federal representatives around how important food insecurity is right now. People need access to SNAP benefits right now. They need access to higher SNAP benefits than they previously were eligible for. We need to allow households to make it through this crisis without experiencing the inability to eat.
Hilary, I'd love you to talk a little bit, there's so much innovative work that is addressing such an important need. I'd love you to just talk a few minutes about how you got to this point of doing this. You're a general internist. You actually you're a researcher. How do you think about an institution like UCSF, which has its primary missions really are about providing care, doing research, and educating the next generation? How does something like ESF grow out of an institution that has these, fairly traditional mission areas?
The work that I do is not traditionally seen as part of the work that a general internist does. And I think it's to the credit of UCSF that they have supported the development of this career and the program of ESF, which really is not something that could have happened within a healthcare system in previous decades. Why is that? It's because it really requires a bit of a paradigm shift on behalf of the institution to really embrace our role, not just as an institution that treats disease once it's already developed, but also an institution that supports the health and wellness of our community more broadly. Healthcare institutions have not traditionally taken on that role, and yet we see how incredibly important that is when we don't have players in the community to do that. Where that has left us is in a massive epidemic, on top of which the pandemic was added, an epidemic of obesity and diabetes that has enormous morbidity and mortality implications across the United States. So UCSF and our providers, I think, have really stepped up to the plate and said that healthy food is part of living a healthy life, and we at UCSF need to be a part of that experience for everybody in our community, from infancy to older age.
That's excellent. Anything else you'd like to tell people before we sign off?
We are extraordinarily excited that UCSF has a really important role to play in this pandemic, not just by providing healthcare, but also supporting the healthy dietary needs of everyone in this city. And we hope that ESF is making a meaningful contribution to supporting the health and the well-being of everyone in our city.
Wonderful. Thank you very much for joining us for the conversation today, Hilary.
Thank you.